NPTE StudyCast.
All right, welcome to NPTE StudyCast with Bridget Reaper. We're talking about Cauda Equina, horse's tail, Bridget.
Yeah, that's direct translation.
If I learned 10 things in PT school, that's one of those 10
It's an
things.
important one to know, Jimmy.
So Cauda Equina, well, what is it? Describe it briefly.
Yeah, so Cauda Equina is just an injury to the lumbar and sacral nerve roots within the spinal canal.
Okay. We know it's involved spinal canal and specifically where, causes or reasons for it?
These patients, you're going to see kind of a variable lower extremity paralysis. You're going to see sensory loss. And the big one for this population is bowel and bladder dysfunction. I know I didn't specifically say how it could happen, but it's just going to be anything that could be damage to the lumbar or sacral nerve roots. So it could be a trauma, any kind of pelvic crush injury. So from car accidents. You can also see this after childbirth, but usually just any kind of damage to that lumbar sacral nerve root area within the spinal cord.
Differential Diagnosis.
I'm guessing all of the other spinal cord injuries.
Yeah, like we've kind of talked about before, any of these can kind of present like each other, especially acutely when symptoms can maybe be a little bit different. But using your clinical presentation of the patient to determine which syndrome you're thinking it is. And then you can also have things like MS, spinal infarct, spinal tumor, Guillain-Barré, transverse myelitis, things like that.
Got it.
Special tests.
What are we going to look at in terms of imaging or?
CT and MRI are going to be kind of the gold standard for the actual diagnosis. But as a PT, if you're not the one doing the imaging, obviously just looking at that clinical presentation and then considering the mechanism of injury.
Treatment example.
And now, what does a physical therapist do about it? Some treatment examples.
You want to always make sure that these patients are managed medically first. For this patient population, it's going to be really important that there's an establishment of a bowel and bladder program, since they usually have some sort of dysfunction in this area. And then focusing your PT treatment on motor learning, task-specific training, neuromuscular re-education and strengthening, weight bearing, tone management, functional E-stem, aerobic training, positioning, splinting, bracing, locomotion if applicable, keeping an eye out for shoulder pain, allowing these patients to compensate when they need to. Typically with other neurological populations, you want to try and limit compensations, but with these patients, you're going to want to allow it just because it's oftentimes going to be needed.
What to know for the test.
Keeping in mind the mechanism of injury, clinical presentation. The big one with this population is that bowel and bladder dysfunctions. If you're thinking Cauda Equina, you should automatically be thinking bowel and bladder dysfunction, and they'll probably work that into some sort of case study, I would imagine.
Well, I think we nailed that one. That's
Cool.
Cauda Equina for the NPTE.
Great.
NPTE StudyCast. Brewed by the PT Pintcast.